Welcome to the Mid-Atlantic Water Program module on emerging contaminants and water quality. These partners were involved in developing this module, and the following individuals contributed to this presentation. Our objectives for this presentation are to define emerging contaminants, give a brief overview of this issue and why it's important to those who rely on both private and public water supplies, to cover research results related to groundwater, talk about some of the efforts being made to collect and properly dispose of unwanted medications, and finally, share disposal recommendations when there is not a collection or take-back event near you. We want to caution viewers that we are talking about very minute amounts of material being found in our water resources. We often measure contaminants in water in either milligrams per liter, which is basically equivalent to parts per million, or in micrograms per liter, which is the same as parts per billion. Often when considering emerging contaminants, we are looking at nanograms per liter, which is basically equivalent to parts per trillion. As a reference, parts per trillion, 1 part per trillion, is equal to 1 drop in 16 Olympic-sized swimming pools. With advancements in science, we can now test water for more compounds and detect them at lower levels. As a result, we've discovered many chemicals present in water that we could not detect before. This is an emerging issue of concern, and these products are often referred to as emerging contaminants or contaminants of emerging concern. A large group of these emerging contaminants include pharmaceuticals and personal care products, or PPCPs. These products consist of a diverse group of chemicals, including, but not limited to, prescription medications, veterinary drugs, fragrances, cosmetics, sunscreen products, diagnostic agents, and nutraceuticals such as vitamins. The National Health and Nutrition Examination Survey data show that the percent of Americans who reported using a prescription medication during the past month increased from 39% to 44% between 1988 and 2002. During the same period, the percent of persons who reported using 3 or more prescription drugs in the past month increased from 12 to 17% of the population. Perhaps more striking is the increase in the percent of older persons who reported taking 3 or more prescribed medications during a 1-month period. Almost half of those 65 and over in 99 to 2000, compared with just over 1/3 in 88 to 94. According to the Center for Disease Control and Prevention, prescription drug abuse is America's fastest growing drug problem. More than 3 out of 4 people who misuse prescription painkillers use drugs prescribed to someone else. Removing these unwanted medications from our homes and our communities can be beneficial for a number of reasons beyond protecting our water resources. PPCPs enter the environment in a variety of ways. Human and animal excretion and feces is a major source. Most human sewage travels to wastewater treatment plants that were designed many years ago. These wastewater treatment plants were not designed to remove PPCPs, so they are released in the plant's effluent to the receiving surface water. In some cases, this same surface water may be harvested by a public water supply downstream to be used for drinking water. Flushing unwanted PPCPs down the toilet produces a similar result. Research is now being conducted to examine how we can produce drugs so that a larger percentage of them metabolize in the body versus being passed through into waste. The research clearly documents a large percentage of these contaminants are being found downstream from our sewage treatment plants. People who understand this issue do not flush medications down the drain. However, for some medications, flushing is still the recommended disposal method because of the danger that they pose to others. The preferred disposal method for these pharmaceuticals is a local drug take-back event. If no take-back program is available, some municipalities may have provisions for disposal. Consult your local waste disposal authority for alternatives to flushing these materials. Another possible source is the land application of biosolids and leachate that leaks from improperly constructed landfills, as well as illegal dumping. All of these can be potential sources of contaminants entering the environment. While PPCPs are being found at very low concentrations in surface water bodies, changes in aquatic organisms are being documented. Large quantities of PPCPs enter the environment after use by individuals or domestic animals. Pharmaceuticals are poorly metabolized, and much of what is taken passes unchanged through humans and animals. Sewage systems are not equipped for PPCP removal. Currently, there are no municipal sewage treatment plants that are engineered specifically for PPCP removal or removal of other unregulated contaminants. While PPCPs are being found at very low concentrations in water bodies, changes in aquatic organisms are being seen. Locations downstream from wastewater treatment plant discharge sites have shown a greater number of female versus male fish, as well as male fish with female eggs in their testes. There's also evidence of poor egg hatching, decreased fertility and growth, and altered behavior, including fish swimming in circles. The number of PPCPs on the market and in the environment is growing. In addition to antibiotics and steroids, over 100 individual PPCPs have been identified as of 2007 in environmental samples in drinking water. If changes are being found in aquatic life, the question of impacts on human health arises. There are currently more questions than answers regarding the effects of pharmaceuticals and personal care products and water resources on human health. To date, there are no drinking water standards for PPCPs for public or municipal drinking water supplies, and we are not regularly testing for them. For a drinking water contaminant primary standard to be set, it has to be measurable in water and have a known human health impact. The short-term effects on aquatic life are being recorded as research is done to gain more understanding on the long-term effect of PPCPs. The U.S. Geological Survey brought the potential PPCP contaminant problem to the forefront in 1999. Scientists studied 139 streams in 30 states and found that 80% of those streams had at least one PPCP contaminant, including prescription and non-prescription drugs, steroids, and hormones. 13% of the streams tested positive for more than 20 of the targeted pharmaceuticals, hormones, or other organic contaminants, and 86% of the 92 contaminants were detected in the 139 streams tested. In 2000, the U.S. Geological Survey sampled 47 groundwater wells in 18 states and found 137 PPCP detections. The PPCP detection rate in the groundwater was less than that in the surface water study, 35% of wells versus 86% of streams. But this research points out that these materials are moving in both surface and groundwater. It's not currently clear which treatment technologies are needed for individual household water treatment systems to effectively remove emerging contaminants. One preventive measure that private water supply owners can take is to treat their water. Activated carbon filters, reverse osmosis units, or a combination of the two are currently the best treatment options for a homeowner. However, more research is needed to determine the effectiveness of these devices. Currently, the best solution is preventing these chemicals from entering our water resources in the first place. Many communities have set up unwanted medication collection events. The DEA, or Drug Enforcement Agency, organized the first National Drug Take-Back Program. Controlled substances were handed over to law enforcement, and the uncontrolled substances were sent to a contracted hazardous waste hauler. The bag of pills on the left was received at the unwanted medication collection event held in Pennsylvania. They had been removed from their containers and stored inside a house for over 20 years, creating both an environmental and health hazard. Collection and proper disposal of this medication ensures that it will not get into the wrong hands and will not cause negative effects on the environment. Prescription drug disposal sites may be available through your solid waste authority or local pharmacies. If there's not a national drug take-back program site in your community, contact your local law enforcement agency and ask about having your community participate. So what do you do if you do not have an unwanted medication collection near you and you need to dispose of medications? These are the federal disposal guidelines. Mix the medicine with kitty litter or coffee grounds and put it in a nondescript container and place it in the trash. The FDA has identified particularly dangerous drugs that they still recommend should be flushed if no take-back vent is available. You wouldn't add pharmaceuticals to your drinking water, so don't flush them down the toilet. This water ultimately ends up back in someone's drinking water supply. Properly disposing of unwanted medicine reduces the concentrations reaching surface and groundwater. Participating in National Drug Take-Back Days offered twice a year in the spring and fall, or mixing your unwanted medicine with kitty litter or coffee grounds and throwing it in the trash are recommendations for properly disposing of medicine. Here are a few additional resources that you can access as needed to learn more about PPCPs and their effects on the environment, as well as proper disposal methods. Sources for each of the pictures shown are given on this slide. Thank you for listening to this presentation on emerging contaminants and water quality. Feel free to view additional cooperative extension information on this topic at this site. Thank you for your time and attention.